Will the Committee of Supply please come to order? This section of the Committee of Supply will now consider the estimates of the Department of Mental Health and Community Wellness. Does the Honourable Minister have an opening statement?
I do.
The Honourable Minister of Mental Health and Community Wellness.
Thank you. On behalf of the Department of Mental Health and Community Wellness, I am pleased to present the financial estimates for the 2023-24 fiscal year. In doing so, I commit to making mental health and community wellness an effective and results-oriented department that will respond rapidly and effectively to the evolving mental health and wellness landscape in our province. We will continue to implement our 5-year roadmap, a pathway to mental health and community wellness, a roadmap for Manitoba, launched in 2021-22, and will continue to lead a whole-of-government approach to invest in core services and supports focused on improving coordination and accessibility of our mental health, addictions, and wellness system. The proposed 2023-24 budget in core reflects an expenditure of $439.3 million and 75.2 staff years full-time, an increase of $35.9 million from the restated 2022-23 budget, or an 8.9% increase. In terms of summary, the 2023-24 mental health and community wellness summary budget is set at $439.3 million. This year's budget includes funding across a number of areas to improve access to mental health, addictions, and wellness initiatives for Manitobans. A couple of examples include $17.3 million in funding to support Year 2 of the 5-year roadmap in the following areas: funding for more mental health and addiction services for Manitobans, improved system access, chronic disease prevention initiatives. Additional investments of $6.9 million in ongoing funding and $2.5 million in one-time funding to support the expansion of new treatment spaces as committed to in November's speech from the throne. This will ensure all Manitobans accessing addictions treatment receive high-quality, safe, and effective care in pursuit of recovery. $3.9 million in funding for medical remuneration increases for psychiatry service supports for both fee-for-service and alternative funding. $1.5 million in funding for ongoing support for the Child Nutrition Council of Manitoba to address increased food costs and demand for additional child nutrition services after expiration of the Home Nutrition and Learning Program. Thank you very much for the opportunity to say a few words on this year's estimates. In closing, I would also like to thank those many public servants involved in the policy, planning, funding, and oversight and related decision-making for the proposed budget. I would now be happy to answer any questions you may have.
We thank the Minister for those comments. Does the critic from the official opposition have an opening statement? The Honourable Member for Point Douglas.
Miigwech, good afternoon, and I want to welcome the Minister to her new role, and I look forward to working collaboratively for the betterment of Manitobans, especially in the area of addictions as well as mental health. We know that there are a lot of people, there's an increase in deaths in our province, and you know, recovery is one thing, but actually getting people to that stage is another. We know that there is increased need for more resources in our community. You know, we've heard from RAM Clinic staff that they're under-resourced. They're turning folks away daily, which means someone that may leave their clinic could leave there and ultimately die. And it's tying the hands of many staff. We've recently, heard from a number of organizations calling on this government to open a safe consumption site to support the work that they're doing in harm reduction, which also includes a safe consumption site. We know that over the past 4 years, a number of fatal overdoses have skyrocketed, with over 400 people losing their lives last year alone. those are somebody's loved ones. That included one of my family members. My brother-in-law succumbed to his addiction. He was in treatment 3 or 4 times. His mother has spoken out about it greatly, that often when you leave these centers, that there's no wraparound services for folks, which means it leaves them, you know, at a vulnerable state to go back to their addiction without having the proper support. So, you know, I really would like the minister to look at something like that in terms of if they're looking at recovery, that recovery also includes wraparound supports when people leave recovery centers, because relapse is, you know, a reality for folks, and we know that addiction isn't something that ever goes away, that people struggle with that day to day. There's a crisis that needs urgent attention, and this government is not treating it accordingly. And Manitobans need this government to come up to the plate and actually start addressing this as a health issue. The lengths they've gone to, you know, to keep their loved ones safe and to keep them, you know, alive. Families are doing their part, but they need this government to do their part. We're hearing a lot from schools that have had to cut social work positions, which means, you know, kids aren't getting the mental health supports that they need. This is the wrong direction. We need this government to be supporting mental health initiatives in schools. In First Nations, we've seen an increase in suicides. You know, there's lots of work to do, and I look forward to, you know, hearing the member answer the question. Resources are there when they need them, and helping to keep people alive. And recovery is not the only way to keep people alive. It's making sure that people get connected to the services that they need to get to recovery. That includes healthcare. You know, if someone goes into a safe consumption site, and I'm not sure if the minister has visited any safe consumption site in Canada, I would encourage the minister to go and visit some of those sites, because you'll hear from firsthand frontline workers, many of whom were in those positions that now have become nurses, have become mentors, have become healthcare providers because of the help that they receive through those safe consumption sites. It's saving lives. No relationship between syphilis and HIV. Those numbers are increasing in our province, and we have a duty as a government, and I'm hoping that this minister will, you know, hear what frontline workers are saying and actually take some of those to heart and start doing some work around them. And I get that there's been investments, but when people are continuing to die and people are continuing to struggle with mental health issues, then that means that we need to make more investments to make sure that people live in this province and that our kids have the access to mental health supports that they need, as well as adults. Miigwech.
We thank the member for those comments. Under Manitoba practice, debate on the minister's salary is the last item considered for a department in the Committee of Supply. Accordingly, we shall now defer consideration of line item 24.1 brackets A contained in Resolution 24.1. At this time, we invite the minister's staff to join us at the table, and we ask that the minister introduce the staff in attendance.
I wait for them to sit.
Yeah. Wait till I sit. The Honourable Minister of Mental Health and Community Wellness.
Thank you. I have with me today Kim Kaufman, the Deputy Minister for Mental Health and Community Wellness, Sandra Hinault, the Assistant Deputy Minister and Executive Financial Officer, Maria Contrio, I hope I say that correctly, Senior Advisor to the Deputy Minister, and Laura Guttormson, Special Assistant to the Minister.
Thank you, Minister. According to our Rule 78, bracket 16, during the consideration of departmental estimates, questioning for each department shall proceed in a global manner, with questions put separately on all resolutions once the official opposition critic indicates that questioning has concluded. The floor is now open for questions. The Honourable Member for Point Douglas.
Miigwech, can the minister tell us how many overdose deaths there were in Manitoba in 2022? Which drugs were the leading cause of the overdoses? So these are actual numbers that I'm asking for, not preliminary numbers. I know the minister has said on record many times that they're on the website, but those aren't definitive numbers from medical examiner. So if you could provide those.
The Honorable Minister of Mental Health and Community Wellness.
I'd like to thank the member for that question, so I'm going to try to break it down and answer it for what we have. So for the 2022, the numbers that we know for sure, Q1 is 78 overdose deaths. The number of individuals who have been put for the preliminary number are at 418, which is a reduction from 2021, which was at 432. We know that there may be a couple of more numbers added to that. We're not sure, but we'll wait for the final report to come out. Justice would most likely be the best place to go for the substance type, but when we're looking at the majority of deaths, we are looking at stimulants and opiates, and the leading cause for substance harms is still alcohol related.
The Honorable Member for Point Douglas.
So can the minister just clarify why I would have to go to justice to find out what drugs people were overdosing on? And also could the minister answer how many overdoses there were in 2022? So not deaths, but overall overdoses, including people who succumb to their overdose.
The Honorable Minister of Mental Health and Community Wellness.
Okay, thank you. So Justice would be the department that you would be referred to because the Office of the Chief Medical Examiner is under Justice, and he oversees all the toxicology reports. As for the second question, the number of individuals reported having had an overdose but not possibly dying, the total number. For Q1, it is 1,154. For Q2, it's 1,248. And for the third quarter, it's 1,193.
The Honorable Member for Point Douglas.
Which I thank the minister for those answers. The minister referenced alcohol in the first question. That was one of the leading causes of death. I asked about overdose deaths, so alcohol is included in those numbers, just to clarify.
The Honorable Minister of Mental Health and Community Wellness.
Just to clarify, I stated alcohol was one of the leading causes of hospitalization, and yes, it is included in the calculations for overdose. But not death, sorry.
The Honorable Member for Point Douglas.
Okay, I thank you for that clarification. The second part of my question, the minister didn't answer. So the overdose death numbers that she provided, can she also provide a breakdown of what drugs were the leading cause for the overdoses?
The Honorable Minister of Mental Health and Community Wellness.
Thank you. The Department of Justice oversees the Chief Medical Examiner, who would be the expert on this. So I would suggest that the member ask the Department of Justice for the leading causes so that the person in charge, the expert, would be able to give her that information.
The Honorable Member for Point Douglas.
Which, it's the Department of it's your department that releases the numbers, though, that is on the website that I'm looking at right now. So I don't understand why I have to go to Justice to get those numbers if it's your department who releases them and it's not the Justice Department. And I'm sure the minister has those numbers or could get those actual numbers of what contributing factors those drugs were led to overdose deaths, but also led to overdoses. So I'm wondering if the minister can undertake that and provide that maybe tomorrow or at a later date. But, you know, going to Justice for these numbers when it's under addictions doesn't make sense. And I think the public would agree with that, and all of the frontline workers. Like, why would they have to go to Justice to get those numbers when it's mental health and addiction has their own department?
The Honorable Minister of Mental Health and Community Wellness.
Thank you. To answer the member's question, fentanyl, methamphetamine, and cocaine were the most common causes of overdose deaths in Manitoba.
The Honorable Member for Point Douglas.
I thank the minister for those answers. Could the minister provide data for 2023 overdoses, as well as how many overdoses, how many resulted in death, and what were the leading drugs?
The Honorable Minister of Mental Health and Community Wellness.
Thank you. That information usually is not released until the chief medical examiner releases it, and as of today, we don't have that information, so I wouldn't want to misinform.
The Honorable Member for Point Douglas.
So that's a good segue into my next question. The Office of the Chief Medical Examiner used to provide updated overdose numbers until March of this year. Can the minister explain, did she direct the Chief Medical Examiner to stop releasing overdose numbers?
The Honorable Minister of Mental Health and Community Wellness.
To answer that question, no. I have not had contact with the chief medical examiner's office, nor have I directed him to not put. What he has done is put preliminary numbers on his website, and he's not giving numbers out to individuals who phone his office. Everyone has to go into the website, so everybody within the public system can see the numbers at the same time.
The Honorable Member for Point Douglas.
Miigwech. So I've been in contact with Mum Stop the Harm overdose awareness group as well that used to work closely with the chief medical examiner in order to get those numbers to let the public know about the toxic drugs that are out there. They're telling us that the medical examiner is telling them that they now have to go through the government to get those numbers, where that didn't exist prior to March. Would the minister agree that there's no harm in the medical examiner releasing those numbers to those groups that are making the public aware of what toxic drug supply is out there, as well as the amount of people that are losing their life due to this toxic drug supply?
The Honorable Minister of Mental Health and Community Wellness.
Thank you. So the Office of the Chief Medical Examiner will provide that data on a broad basis so that everyone is able to see the information. This is proactive. It's for the public to see at the same time. That way everyone is able to access the information. And to go back to one of your previous questions, in 2023, the first quarter, the number of overdose events as reported by the fire and paramedics were 476.
The Honorable Member for Point Douglas.
So I just want to go back to that question. The minister has cited many times that they don't have access to the numbers, that it has to go through justice. It is the Department of Addictions, so I'm not fully understanding why the Department of Justice would have to give those numbers to the addictions minister when that is the minister's portfolio, and to adequately respond to what's going on out there and make sure that the supports are there, that the Manitobans know about the toxic drug supply, that they know how many Manitobans are losing their lives, as well as how many people are overdosing. I think the city has done, a great job in terms of providing those numbers, but we have a province who is not doing their job in providing those numbers. And we need to be leaders in this to ensure that these numbers are decreasing. Like, you've given me a preliminary number. We don't even know if that is the accurate number yet, because you said it's a preliminary number, and you are waiting for the numbers from the chief medical examiner to go to justice, and then for justice to look at those, and then that to be sent to you. Like, that is a lot of red tape, and we need to eliminate that. These are people's lives that we're talking about. So again, I'll ask the minister, why is this red tape in front? Why is it having to go through justice? And why doesn't the minister have up-to-date numbers, and why aren't those being accurately reported to the public?
The Honorable Minister of Mental Health and Community Wellness.
Thank you. So the Office of the Medical Examiner is under justice, and as the chief coroner for the province, he reports on all deaths, so he's the centralized person for all the deaths in the province. So That is why we would have to go to him for any of the overdose deaths or any deaths of any kind for our department. So as a whole of government, that would be where everybody would go. Service information from other resources are also utilized so that we can get other information when it comes to substance-related harms and trends that are going on currently.
The honourable member for Point Douglas.
So I hear what the minister's saying. I still don't understand the process. There's still lots of red tape. The minister should be able to go to the chief medical examiner about her own file that relates to addictions and addiction overdoses and to find out what drugs people are overdosing on. So I'll ask the minister, is the minister aware if anyone in her department or the Justice Department directed the medical examiner, chief medical examiner, not to give any information to any of these groups, whether it's overdose awareness, Mom Stop the Harm about the overdoses that are happening in our province, and as well as the drugs that they're overdosing on?
The Honourable Minister of Mental Health and Community Wellness.
Okay, so this is going to answer a few of the points that the member opposite has brought up. So under the Manitoba Fatalities Inquiries Act, the chief medical examiner has the responsibility for the investigation of all unexpected and violent deaths occurring in the province. So that's why it falls under justice. As per the directed the chief medical examiner to get, there's no to that, and then have access to information from the chief medical examiner. If I'm needing to access information, I am able to access it. So it's not that it's not available to me. It's publicly put on his website when he puts it on, I guess, when he gets the numbers.
The Honourable Member for Point Douglas.
Miigwech. So just to be clear, so the minister has to wait until those numbers are published before they have access to those numbers, or they have to go through justice otherwise?
Can the member clarify? Oh, sorry.
The Honourable Minister of Mental Health and Community Wellness.
Sorry. Can the member clarify what she's asking?
The Honourable Member for Point Douglas.
Miigwech. So they have access to the numbers, but they have to access through the website. So I'm asking the minister whether they have to wait until those are published on the website before they have access to those numbers and the drugs that the toxic supply that people are overdosing on, or do they go through the Justice Department? So could they have clear access to the medical examiner to get those numbers, or do they have to wait till it's published on the website or go through the Justice?
The Honorable Minister of Mental Health and Community Wellness.
Okay, thank you. So the Office of the Chief Medical Examiner will inform the department prior to the release of any public numbers, what the numbers are for that period prior to their releasing it. So if it's Q1, it's Q1, but these would be the preliminary numbers.
The Honorable Member for Point Douglas.
So I'll ask that question again. So I know that you said that you have to wait for those preliminary numbers, but what I'm asking the minister is, does the minister have access to those numbers before they are published? Or do they have to go through justice to get those numbers? And if they have to go through justice, or if they have to wait to see it on a website, how are they able to adequately get in front of what's happening in the community and, give timely data to frontline organizations that rely on this data?
The Honorable Minister of Mental Health and Community Wellness.
Okay, so I'm going to hopefully be able to answer the question through this explanation. So the information that the Chief Medical Examiner provides, we have access to prior to it being published. He is the only individual within the legislation, within the province, who can provide those numbers. So we have to wait for him to give us those numbers. We also have other resources that we look to when we're looking at the trends or the causes of individuals who are accessing different drugs. So he is one of many that we utilize, but he is the only one with the authority to give those numbers.
The Honorable Member for Point Douglas.
Okay, I'm hoping that the minister has access to those numbers and doesn't have to wait till they are on a website or go through justice, because it is within your portfolio and you should be able to access those numbers and not have all that red tape. And if the minister does have that red tape, I hope the minister clears that red tape, because again, we're talking about people's lives here in Manitoba. Can the minister tell us how often the medical examiner provides those numbers? Like, is it monthly? Is it quarterly?
The Honorable Minister of Mental Health and Community Wellness.
Okay, I think I need to clarify. The numbers that we have from the Chief Medical, I have access to. So we are able to access numbers from the Chief Medical Examiner. There is no red tape. We're able to access them when we need them, so we can rely on the professional to assist us with it. When it comes to the policy, you would be better to go to the Department of Justice and ask them the question with reference to how the legislation is set up with the Chief Medical.
The Honorable Member for Point Douglas.
Okay, I'm happy to hear that because the minister did refer me to Justice to get those numbers. So that's why I kept clarifying whether the minister actually had access to those numbers. So I'm glad to hear that. I don't know why the minister would direct me to Justice if they have those numbers and we are in addictions and mental health. You know, estimates here, and it is questions around that overdose reporting. So, and I did ask how often those numbers are provided. So whether they're monthly or whether they're quarterly from the chief medical examiner to whether it's Justice or mental health and addictions.
The Honorable Minister of Mental Health and Community Wellness.
Okay, so the numbers provided from the Chief Medical Examiner's office are provided monthly, but the numbers are dependent upon a few conditions. So depending upon autopsy, toxicology, and if family members have been notified. So the numbers can change depending on some of those circumstances.
The Honorable Member for Point Douglas.
Which frontline organizations rely on timely data. I just heard the minister say that they're given those numbers monthly. I'm wondering why the minister's office is not reporting on those numbers monthly. We are the only province in all of Canada that doesn't even report numbers, and other provinces are reporting monthly. And this is information that frontline organizations rely on to keep, the folks alive that they're working on. They also rely on that data to inform people in the community of the toxic drug supply that's out there. I've seen a number of media releases from the Winnipeg Police letting the public know about the toxic drug supply. We as a province, as a government, and you as a government, as a minister, have a responsibility to let the public know about that. So can the minister tell us why we're not getting timely data when they're receiving that data monthly? And why isn't it being reported on the Canadian website?
The Honorable Minister of Mental Health and Community Wellness.
Okay, thank you. So if the member opposite would go to the Office of the Chief Medical Examiner's website, there is monthly reporting of all of the data that she's looking for, up to as current as they have. So that information is there. And if they go to the website under the Mental Health and Community Wellness, the website also has the numbers of overdose, substance-related omissions, fatalities, naloxone. It's all broken down, even by gender, so she'd be able to find all of that information.
The Honorable Member for Point Douglas.
So can the minister tell us why that data isn't released to the public and why we are the only province in all of Canada that doesn't publish on the Public Health Agency of Canada?
The Honorable Minister of Mental Health and Community Wellness.
Thank you. Okay, so if the member were to go to the Public Health Agency of Canada, you would see that we do report to that site. And if she were to take a look at the site, you would see that there is up to date on the hospitalization and emergency room services for Manitoba.
The Honorable Member for Point Douglas.
I would ask the minister to actually go on that website and look at it. We are blank in that department. We've never reported as a province on there. So if you go on to that Public Health Agency of Canada, we're right in the middle, and it's got a big circle that has nothing in it. There's no number for Manitoba. Receives data monthly. I'm still recognized. The minister receives data monthly from the chief medical examiner. Why is there a lag in the numbers coming out? The minister gave me the first quarter we should be reporting monthly. Why are we not reporting monthly when the minister is receiving those numbers monthly on the website?
The Honorable Minister of Mental Health and Community Wellness.
Okay, thank you. So if the member were to go back to that website and scroll through, she would see that the data is in there. The data has been put on there every year up to 2022, the updated, and we don't put or report anything that's not been audited on the website because it could be subject to a lot of change. So if you're looking at the quarterly would be what we would put, that would be the accurate information.
The Honorable Member for Point Douglas.
Miigwech, I just went on to the government website and there's no monthly reporting. There's quarterly reporting and it's from last year. There's nothing for 2023. The minister did say that they receive monthly reports from the medical examiner's office. The office of the chief medical examiner says that there's no lag in toxicology reports, and the province themselves have said that they choose not to submit the data. Why is the minister choosing not to submit up-to-date data?
The Honorable Minister of Mental Health and Community Wellness.
Okay, so just to clarify some of what's being said. So the monthly reports are internal and they're with preliminary numbers. The reports going to the Public Health Agency of Canada are quarterly, and those take about 3 to 4 months to have the toxicology reports come back. So we can't do the preliminary numbers monthly until the toxicology is in place. So then that's the 3 or 4 month wait time for those numbers to go out. So the preliminary numbers monthly on the Office of the Chief Medical Examiner are preliminary. The public health one are not preliminary, but they also wait for toxicology to come back to put them on.
The honourable member for Point Douglas.
Miigwech, I'm just going to clarify here. I did cite that the Office of the Chief Medical Examiner said that there's no lag in toxicology reports. So I think what the minister is trying to say that maybe autopsy reports are slowing that down, which I could, agree with, but because there's not enough resources and people are having to wait up to a year, we've had several complaints from community members in regard to autopsy reports. But when it comes to toxicology and identifying the drug that people are overdosing on and losing their lives on, there is no lag in that. So I don't understand, the public doesn't understand, the frontline organizations that are, doing harm reduction work with folks trying to help keep them alive, as well as the family members who have lost loved ones and those that are trying to keep their loved ones alive, don't understand why these numbers are being kept from the public and why the toxic drug supply in which they are overdosing on is also being kept from the public. So when the minister says that they're reporting quarterly because there's a lag, because they have to wait for reports from the chief medical examiner, the chief medical examiner said themselves that there is no lag in toxicology reports. They do a toxicology, they test the system for drugs and see if that was an indicator of an overdose. My father himself died of a cocaine overdose. So I know exactly what a toxicology report looks like. It tells you what was the leading cause of death. And we got that within 30 days. So I'm just putting that out there. But I want to ask the minister if they'll commit to releasing up-to-date 2023 data before the next election, overdose death data before the election.
The Honorable Minister of Mental Health and Community Wellness.
Okay, so I just want to correct something. So there are no delays with the Chief Medical Officer's office because the process tends to take 3 to 4 months to determine toxicology. For certain individuals, depending upon the incident, they may let family members know, but that wouldn't be the accurate data that they would be coming up with for the numbers for a month. They'd have to wait for the toxicology report. So in their process, they're not delayed, their process is on time. When it comes to the process of how they go about getting all of these numbers, I would have to redirect you back, or sorry, the member back to the office of the Chief Medical Examiner through his policy process. How he does that would be under his department, not mine. And I don't have the authority under the Act to release numbers from the office of the Chief Medical. That is his office that releases them. I can't force them. So process is 3 to 4 months. He is not behind. He is going within his process timeline. There may be the independent ones, but those would be specific to certain families.
The Honorable Member for Point Douglas.
So I'll move on, but I'm going to come back to that probably tomorrow. So I'd like the minister to undertake some of the questions that I asked, as well as look at those websites for themselves, because you've referenced that those numbers are on the website. They're not. So you should be aware of that. The other thing is, so if it's not a delay in the Chief Medical Examiner, then what you're saying is it's a delay in your department in releasing those numbers, because if they're releasing them to you, then you're not releasing them to the public. So it's not the Chief Medical Examiner's job to put them on the website, the government website, which is a bill that I brought forward asking the government to put in a timely manner on the website how many overdoses, as well as the drugs that the people are overdosing on. So the Chief Medical Examiner can't do that. It's up to the government to do that. You get the numbers, you put them on. He can release them through his office. But anyway, I'll move on from there. So I want to talk a bit about the Virgo report and what the Virgo report referenced in terms of safe consumption site. I'll ask the minister whether she believes the experts when they say that safe consumption sites save lives.
The Honorable Minister of Mental Health and Community Wellness.
Okay, so I just want to clarify that the authority is given to the office of the Chief Medical Examiner under the Fatalities Act to release the information. It is not dependent on us. Information we get prior to it going out to the public, we have. And we will put, once the office has given us the information, we'll put it on our website. So we're not withholding anything. We're putting it when we're getting it. And we can't put it before they do. And any other questions, I guess, related to the chief, you need to redirect back to Justice, because that's under the Justice Department.
The Honorable Member for Point Douglas.
Miigwech. So the minister earlier said that they received monthly data from the Chief Medical Examiner. So I am like totally, I'm lost here, because if you get monthly data from the Chief Medical Examiner and they release it to you and you're not releasing it to the public, and and to community organizations that are in the front lines to adequately do their work and to adequately let the public know about what toxic drug supply is out there. I'm confused whether, you know, who's holding it up. So you're saying the chief medical examiner is taking up to 3 months to give you these numbers, which is holding your department up to release these numbers, or is it the chief medical examiner is holding the numbers up and giving them to you so that you can't release them? I hear what you say, that they put them on a website, but the chief medical examiner says there's no lag in toxicology reports. They're taking up to 30 days to release. You're getting preliminary numbers, and that's what your data is from 2022. We have no data for 2023 yet. We're now into June, so that's how many months? We don't even have a quarterly report. You just provided that number to me, but the public has no idea what those numbers are. Frontline organizations have no clue what those numbers are. So how are they to adequately do their job? And then the third thing is the chief medical examiner was directed by, I don't know if it was your department or the Justice Department, but somebody directed the chief medical examiner not to speak to anybody outside of government. He is now being directed to tell folks that go and try access those numbers to go to the government for those numbers. So if it's a chief medical examiner that has those numbers, why isn't the public having access to them, and why is the government silencing the chief medical examiner from giving those numbers out to the public and to frontline organizations? And why is your government silent on those numbers? We're now into June. The public should know about those numbers. Frontline organizations should know about those numbers. Families that are fighting to keep their loved ones alive should know about those numbers. And certainly people who are thinking about doing drugs should know about the toxic drug supply that's out there. And it's disheartening for me to sit here and continue to hear the minister say that it's taking up to 90 days, we're not getting any reports, but then earlier the minister said that we're getting monthly reports, and then they're saying that we have to go through justice because the chief medical examiner is under justice. I'm just really getting a little bit frustrated here, and I'm kind of paraphrasing and kind of summarizing everything because our health critic is here now, and I just want them to also hear, because we do a lot of work together and we work with a lot of the same frontline organizations. So again, if the member can reiterate some of that information, because I didn't get any answers from those questions that I asked. And you went to the chief medical examiner's website and you actually read directly from there. I can do that. You also referenced going to your website and said that there were monthly numbers, which there is not. And then you also said that you report to Public Health Agency of Canada. But how many months after the whole year is that number being reported? We're the only province that isn't giving monthly updates. We're the only province that doesn't report monthly. And we're the only province that isn't working collaboratively with frontline organizations to ensure that they have the services and supports that they need to save lives.
Excuse me, before we continue on, I'd just like to remind the member to go through the chair, directly, instead of going directly to the minister. Thank you. I would just like to remind members, if they need to use the phone, to please go to the back of the room, not at the table, please. The Honorable Minister of Mental Health and Community Wellness.
Okay, so there's a lot of accusations, so I'm going to clarify the accusations. So there is one data source, and the Office of the Chief Medical Examiner is that data source, and the preliminary numbers are up to date as of December 2022, and the Office of the Chief Medical Examiner posts those numbers. Our department does not release data. That is not our job. That is the Office of the Chief Medical. And quarterly numbers are on the website and the Public Health Association of Canada. The provinces report quarterly. So when we're looking at the numbers, our department does not release it. Quarterly numbers on the website are audited. They're not preliminary. And the numbers that are on the December 2022 of the Office of the Chief Medical are preliminary. I don't know if that cleared it up, but that's clear answers to what you were stating, which you were misstating.
The Honorable Member for Point Douglas.
I just want to clarify that the minister did say that there were up-to-date numbers on their website, so Mental Health and Addiction Community Wellness website, that they were reported monthly. They are not. The minister just said that the numbers are up to December 22. Yes, they are there, but it took how many months for those numbers to get released onto the website? So when the minister's saying that they don't release those numbers, that it's not up to the government to do that, we are asking, and so are frontline organizations, so are families, that the government takes responsibility and actually releases those numbers and lets the public know what the accurate numbers are monthly or in a timely manner. If the minister is saying, well, we can't report them every 30 days, then make a commitment to report them maybe every 45 days. Make a commitment to report on what toxic drug supply is out there so that organizations can do their work and adequately resource themselves, and that the adequate resources can be put in place by this government. 2022 numbers, when we're already into, almost the 6-month, like halfway mark of the year, is unacceptable. When people are losing their lives, these are people. These are Manitobans. These are folks struggling with addictions. And having a recovery model doesn't suit those that aren't at that place for recovery. So I'll ask the minister again, and I cited the Virgo report in which a safe consumption site was referenced. So I'll ask the minister, does the minister agree with experts on the fact that supervised consumption sites save lives?
The Honorable Minister of Mental Health and Community Wellness.
Thank you. Okay, so we know recovery is possible for all Manitobans, and we know that our government is committed to a recovery-oriented system of care. That is why we believe in investing in the supports to put them in place for individuals who are seeking these services so that they're available to them. It's why since 2019, we've invested in more than 47 different initiatives, over $62 million to assist individuals with access to RAM clinics, clean supply, naloxone, supports, counseling, resources.
The Honorable Member for Point Douglas.
Miigwech, so my question to the minister was, does the minister agree with experts on the fact that a safe consumption site saves lives? And I'll ask again.
The Honorable Minister of Mental Health and Wellness.
Okay, thank you. So the recovery-oriented system of care is based on evidence, and my opinion of recovery is mine. It's of no relevance.
The Honorable Member for Point Douglas.
You know, I'm kind of at a loss here because, you know, this government believes in a recovery-based model, and they say that they believe in harm reduction, and safe consumption sites have proven to save lives. And I said to the minister earlier that I encourage them to actually go and visit a safe consumption site, to actually talk to frontline workers who every day are heroes, who are saving lives. And it is a responsibility of this government to actually look at best practices across other jurisdictions and to do everything that they can do to help save lives. And this has been proven to save lives. So I'll ask the minister, will the government open a safe consumption site before the 2023 election? If not, why not?
The Honorable Minister of Mental Health and Community Wellness.
Thank you. So the Stanford Lancet Commission's report from 2022 stated research on supervised consumption sites is methodologically weak. There is no evidence that assessing a site lowers an individual's risk of fatal overdose over time, or that sites lower community overdose rates. Rigorous research on supervised consumption sites is necessary.
The Honorable Member for Point Douglas.
I see the minister has looked for cons. Has the minister also looked at pros, like looked at expert advice from across Canada and beyond? You know, you have a premier who misled Manitobans when they claimed that a supervised consumption site failed in California, despite the fact that there is no safe consumption site in California. So I'll ask the minister, does she agree with her premier? And has the minister looked at any other expert advice on safe consumption sites other than why not to open one?
The Honorable Minister of Mental Health and Community Wellness.
Thank you. So I just want to refer back to your opening comments. Contrary to what you said, that there have been no deaths, there have been deaths reported in a supervised consumption site. And have we consulted? Absolutely. We've consulted with experts from other jurisdictions, and we've seriously considered benefits and risks before making any changes to our policy. And it's for these reasons that we have maximized benefits and risks before making any of the policy changes.
Before I recognize the member, things have been going very good here, but I'd just like to remind everybody about going through the chair and, things are nice and calm, so I'd like to keep them that way.
I apologize.
The Honourable Member for Point Douglas.
Miigwech. So, in the fall, the minister's predecessor stated that her continued opposition to safe consumption sites was reinforced by tours of Vancouver's site. However, BC officials corrected the record, saying that the minister never actually toured Vancouver's sites. Does the minister think her predecessor misled Manitobans by claiming that she toured a safe consumption site in Vancouver when the fact is she never did?
The Honourable Minister of Mental Health and Community Wellness.
Thank you. I can't speak to what another individual or member does, but I am here to speak to the budget if you would like to ask questions about the budget.
The Honourable Member for Point Douglas.
Well, the minister did reference that they have done extensive research, and I would think that, the minister's predecessor misleading Manitobans in visiting a safe consumption site versus, walking by and taking pictures of people who are struggling, that's very disrespectful, for one. Two, looking at, again, through a biased lens at people who are struggling versus actually going into a safe consumption site. And I've encouraged the minister again to go and visit one of these sites because, again, these sites are staffed by people who provide primary health care. So they connect people who may have not ever seen a doctor in their life, who may have infected veins, who may be infected with HIV and possibly spreading that or a bloodborne disease through unsafe, use. People go to these sites to access safe supply. And we've had over 400 deaths here in Manitoba. And when the minister references, that people are dying and that there have been deaths in safe consumption sites, 416 Manitobans have lost their lives here. And even more are being infected every day with an STBBI. Syphilis is on the rise. Congenital syphilis is on the rise. HIV is on the rise. People are getting infections. They are not being medically treated. They're going to RAM clinics and being turned away. They're being told to make an appointment. When somebody wants to go into treatment or recovery, as this government is taking that stance, and I know when I visited Alberta, they also have a conservative government over there. They have been closing safe consumption sites in their province, which has led to a rise in deaths, which has led to a rise in STBBIs. Risky, risky, risky. When you're looking at the amount of money it costs to support someone with HIV, and my colleague here, the member from Union Station, it's over $1 million they shared with me for one person. One person. So when we're looking at the amount of people who are using drugs unsafely and not having access to the services and resources of a safe consumption site where they can use clean needles, where they can use it in a safe place, where they can learn to actually use it in a safe way, where they're not getting infections in their veins, where they can actually connect with someone to look at recovery, where they can actually connect with someone to maybe get into to see a counselor about some trauma that they've dealt with. And we know that's one of the underlying issues why people are using. Why would we not invest in those sites? Why do we continue, or why does this government continue to look at why we should not invest in safe consumption sites? They've been proven to save lives. There's expert advice out there. There's data on, you know, the benefits of a safe consumption site and the overall health of the folks that are using those sites. And I referenced this in my opening statement that when I was visiting, you know, I went to 4 different provinces and visited probably about 6 different safe consumption sites and went inside these sites, actually spoke to the folks who were using, spoke to the frontline workers that were there. And, you know, they were so respectful that they introduced me and asked the folks that were in there using that if it was okay if I was there. So they didn't just invite me in and say, come watch these people using. They actually explained that I'm a politician from another province looking at best practices. Is it okay if this person comes in and, you know, speaks with you? So it was done in a respectful way. I would never go into somewhere and take pictures or use that for my gain. For me, it was about seeing, hearing, and helping these folks to have voice. And it was resounding that they were connected with the resources that they needed. And I shared that many of the folks that worked in these sites became nurses, became mentors, became youth care workers.
Unfortunately, the member's time has expired. We'll continue on. The Honorable Minister of Mental Health and Community Wellness.
I'm not sure if there was a question in what you were stating. If you want to put a question. Thank you.
The Honorable Member for Point Douglas.
Miigwech, there was a question in there. I asked why we would not invest in safe consumption sites when we have all of these, you know, resounding benefits that are getting folks connected to the resources that they need, whether it's safe supply, whether it's connecting with a primary health care provider, whether it's even having hope, listening to other mentors who are working there that actually were users themselves. Looking at best practices, and again, you know, actually going and listening to these folks and seeing them as human, and, you know, not looking through our bias lens, but actually looking at what's best for Manitobans and what's best for helping to save lives. Because again, you know, we can cite the numbers, but at the end of the day, these are humans, these are people, these are Manitobans, and we do have a duty to look at best practices from not our own lens, but the lens of what's best across different, you know, jurisdictions and what's worked there and will it work here? And if it won't work here, how do we make it work here? You know, recovery is, and you know, this government keeps talking about recovery. I still drive down Main Street every day. You know, that's my constituency. I see people struggling all over. You come downtown, you see people struggling here. When you leave outside this legislature, when it's winter, there's people in the bus shacks, even in the summer. Like, these are people that are struggling. These are Manitobans that need our support, and they're using unsafely in bus shacks. We should be providing the services that they need, and there is a real need for safe consumption sites. Over 80 organizations signed on asking for this government to open up a safe consumption site to help them do the job that they need to do, that there is a need, and they're on the front lines. They're the ones that are doing the work. So why would we not open a safe consumption site here in Manitoba is my question.
The Honorable Minister of Mental Health and Community Wellness.
Thank you. So all of the resources and supports that you cited are there for a site, but they're not always implemented. That's why we introduced the bill, to help ensure that all the services you described are available to individuals who are seeking a supervised consumption site. So to follow that up, in April, we also invested 2.1 million in spending to support the existing emergency mobile crisis response programs in MKO and the Southern Chiefs Organization, which received 1.06 million to support Indigenous-led and culturally appropriate care in their communities. This was an INIR announcement. And then on March 14th in 2023, the Manitoba government announced more than 12 million in initiatives aligned with the Throne Speech commitment to enhance and support up to 1,000 addiction treatment spaces, including nearly $1 million to support existing community addiction treatment agencies to address fiscal changes, ensure quality service, maximize existing capacity. 2.64 million to add rural medical withdrawal management spaces in Brandon, Portage, and Ashern, which are expected to provide services up to 300 Manitobans annually, and $8.8 million to secure publicly funded treatment spaces through an expression of interest for qualified addiction services providers to bid on opportunities to implement additional spaces, including bed-based treatment, intensive day programs, and supportive recovery housing. And then on the 28th of February 2023, the whole of government $126 million announcement to address chronic homelessness through strengthening existing services, delivering 24/7 access to shelters, training shelter support workers with critical skills in mental health and addictions, de-escalation techniques, and trauma-informed care. Funding 700 new social housing units to be built this year, and increasing the maintenance budget of existing social housing through families. Our government opened the round clinics. That is 7 clinics, which is 7 times the number of clinics that were open under the previous government. So we are putting supports in place. We are listening to individuals, and we are ensuring that they have places to go to assist with their addictions.
The Honorable Member for Point Douglas.
So the minister referenced all of those, supports, but the numbers are trending in the wrong way, in the wrong direction. More people are dying in the last 7 years through addictions than previous years. Does the minister think that the government is doing enough to address the addictions crisis here in Manitoba?
The Honorable Minister of Mental Health and Community Wellness.
Okay, so I'm not here to give an opinion. I'm only here to talk about facts. So the numbers trending down from 2021 to 2022, there are fewer individuals with overdose than there were in 2021. We have invested monies into supports so that individuals are able to seek the support where they need, when they need it. Withdrawal mobile units, short-term, long-term mobile services, so individuals are able to seek the support in their community. We are investing, and we are here today to look at what resources we could further implement and put in place if members opposite would pass our budget.
The Honorable Member for Point Douglas.
So the minister is the minister of this department and has the authority to, administer the funds in the areas that are needed. So does the minister think that their government's 5% increase in mental health and addictions core services and areas of need this year is not enough to meet the demand? And I'm asking the member as the minister, not as themselves. They are the head of this department, and they could have answered the question because it was directed, does the minister, not my personal hat, you may have your own personal opinions and biases, but I'm not asking as, that member, I'm asking as the minister of mental health and community wellness, whether they think their government is doing enough to address the addiction crisis and whether a 5% increase in mental health and addiction core services in the area of need this year is enough to meet the demand.
The Honorable Minister of Mental Health and Community Wellness.
Okay, thank you. So The increase to the Department of Mental Health and Community Wellness is 8.9%. And that money has gone into the addiction supports and treatment services, which we've made as a priority within this department. So in 2022, the Manitoba Mental Health and Community Wellness launched the 5-year strategy plan, A Pathway to Mental Health and Community Wellness, a roadmap for Manitoba. And it focused on improving wellness, mental health, substance use, addiction services, and programs throughout the province. An investment of $17 million supported the first year of this roadmap. As part of this roadmap and the historic investments for the new and continuing initiatives, our government continued to focus on harm reduction and recovery-oriented addiction treatment services. Since 2019, we've announced more than 52 initiatives at more than $65 million to improve mental health and wellness.
The honourable member for Point Douglas.
So I just wanted to go back to what the minister said prior to this about, the numbers trending down. We knew that the number was 408 before the definitive numbers came out in 2022 or 2021. We don't know the definitive numbers for this year yet, or for last year, pardon me, because those haven't come out. Could the minister provide when the definitive numbers are going to come out? And just to be clear, and I've said this many times, regardless if it's one person who's died of an overdose, these are Manitobans, these are people we're talking about. And if it's one Manitoban, 400 Manitobans, we have a duty as Manitobans to act. And I just want to refer the minister to page 20 of the estimates book that says performance measure under increase equitable access and coordination, the performance measures. It says that an increased mental health and addictions core services in areas of need, that the target was 5%, and that the target for this year is 5%. So are these books not accurate if you're saying that there's been 8.9% increase versus what's in the estimates book? I'm a little confused here.
The Honourable Minister of Mental Health and Community Wellness.
Okay, yes, and I would agree with members opposite. One death is one too many, and we can't be playing with human lives as data on a sheet. But in 2021, the numbers were at 432, and in 2022, 418, and then they will be confirmed. So that is a decrease in the number of individuals who were who had died from overdose. With respect to the 5%, that's not a fiscal target. That is a goal to add that much more percentage for supports to the existing supports that we currently have, so individuals are able to access more.
The honourable member for Point Douglas.
Okay, the minister referenced 1,000 treatment spaces earlier. How does the government define an addiction treatment space?
The honourable Minister of Mental Health and Community Wellness.
Okay, thank you. So the 1,000 treatment spaces will include a variety of services if the budget passes. So it is the number of people that can be served through these. For example, on average, there would be 1.25 spaces for supportive recovering housing units, as the average length of stay is 6 to 12 months. As for longer-term bed-based treatment, one bed could potentially result in 4 spaces, and average as a person stays on average in these programs for about 3 to 4 months. So the bed treatment spaces would be determined upon the individuals accessing the services.
The honourable member for Point Douglas.
So just to clarify, these aren't 1,000 new beds. These are like 100 people who might access that same bed 10 times, or 100 people may go through that bed. Okay, hang on a second. I gotta wrap my head around this. So 100 people or 100 folks going and using that bed 10 times would count as 1,000 beds. So it's not 1,000 new beds. So let's look at Morgabird House, for instance. Let's say they have 30 spaces. 30 people go through there, and then another 30 come through, and another 30 come through. It's not actually 1,000 new beds. It's just 25 new beds, but 1,000 people will go through there. Am I correct? Or are you understanding what I'm saying? So it's not 1,000 new beds. It's treatment spaces for multiple people to use. So it could be 25 spaces and let's say 100 people go through there. And it's counted as that many spaces. I should ask my question.
You're making sense.
Yeah.
The hour being 5 p.m., committee rise.